Bringing tension to the appropriate musculature means strengthening something. So I'm a really big proponent of bringing appropriate analogous tension forces, doing pushing exercises horizontally and doing pulling exercises, but with the idea of saying, how is my resting tension between these opposite musculature? Because if you can do that, and then you consciously make the choice to maintain your posture, we are setting ourselves up for minimal joint degeneration. And when you minimize joint degeneration, you have true longevity when it comes to fitness, minimizing pain, and having a really amazing life.
Hello and welcome to the Posture Dojo podcast. My name is Sam Miller. I'll be your host on this postural transformation journey, sharing some stories from my own healing journey of an 85-degree hyperkyphoscoliosis and speaking with experts from a variety of fields. Some fields that you might expect, some that are a bit more surprising. But today we have Dr. Chris Stepien on the pod, who has survived a recent incident. If you're watching, walk us through your background and then how this happened.
Yeah, man, I'm a chiropractor, and halfway through chiropractic school, I was thinking of quitting school because chiropractic adjustments weren't helping my already mild chronic pains. And I got lucky about my sixth trimester of 10. My mentor gave a speech at the school, and he said, how many of you are being taught that you can help everybody with chiropractic adjustments? And we all raised our hands. And he said, well, I don't believe that, but I believe you can help some people better than anyone else is helping them. And he was talking about chronic pain sufferers with the diagnosis and treatment of adhesions. And he started treating my hip flexors and my psoas especially. And I noticed amazing results in my low back pain, and I was hooked. And that's how I got into this world of specializing in non-surgical chronic pain relief, to the point now where I'm teaching it and helping other doctors and therapists learn how to fix this stuff. And yeah, on Monday I was walking on the street and I was doing breath work. And if you know what breath work is, you're not supposed to do it while you're standing or walking. So I was doing a breath hold and I felt myself about to pass out. I got to my hands, but I couldn't stop my face from slamming against the street. And that's what this beautiful face is now.
So you're a living testimony to the dangers of walking meditations. Is that where we're at?
You could say
Yeah.
that. Do not hold your breath and walk, especially when you put some oxygen in there.
Yeah, I mean, I've certainly had some of those moments, especially in the gym, sometimes getting into those deep squats, getting into loosening up, maybe releasing some adhesions, I don't know, and then you stand up and it's like the system boots up and you get this edging of consciousness kind of wobble. I know I've definitely been there and teetered on the edge. We're glad you made it and you're able to show up for the podcast.
I'm alive. Thanks for having me, Sam.
So releasing adhesions, are we talking adhesion of muscle, fascia, or a little bit of both?
Yeah, I mean, I would argue that any adhesions are inside the fascia, and whereas the fascia could be outside of muscles, inside of muscles, outside of nerves, inside of nerves. I don't know about inside of bone, but around bones, ligaments, tendons, organs, and everywhere in between. I find that probably 80% of my time now is spent on treating adhesions between nerves and muscles, so nerve entrapments, and primarily focusing on chronic pain sufferers with musculoskeletal pain who are 30 to 60 years old, have had pain more than 6 months, and seen at least 3 doctors or therapists without relief. So as far as the posture thing, it's funny. I just did a consult with a woman from Montreal who's going to come down in a couple weeks for treatment, and she actually had a mild scoliosis. And I said, I just want to be clear with you. This sounds like something I'm going to be able to help your pain and give you sustained relief. Whether your scoliosis range of motion gets better, I am not promising that because I haven't found that can be consistently worked on with adhesion release. But the pain from scoliosis or posture being bad, yeah, that's what we help all day, every day.
The approach that I'm giving to people who have kyphosis or scoliosis is a 3-step process that eventually becomes integrated into one step, but it's unraveling, aligning, and fortifying. I think that's a healthy just understanding that somebody with these type of compromised postures needs to go down. And this unraveling part, I think, is really where you're honing in on, allowing people to unravel potential compensations and
Mhm.
compressions. What are some common type of adhesions that you're finding in this day and age, in particular when it comes to posture?
In particular, when it comes to posture, I mean, the biggest one has got to be neck pain by far. I remember probably a couple years ago, I saw my first 14-year-old with a cervical disc problem, and the kid in the waiting room was sitting there like this, looking at their phone, and I remember thinking to myself, "Oh no." Horrible. So it's gotta be neck because that's the biggest thing with our phones now. We're all hanging our head. I don't wanna say all of us. I'm not, and you probably aren't either. Most people are hanging their heads too far down, too low. I'm treating a 25-year-old right now. He was having neck spasms in January. They went away after 3 days. He had them again 2 months ago, and they didn't go away. And then I diagnosed him with a cervical disc problem causing those spasms. And just today, he's 15 visits in, he's 80% better. And I said, Taylor, why am I walking in on you sitting like this? Because every single time I see him, I'm like, Taylor, you have a really bad disc problem already and you're 25. If you keep doing this with your posture, I'm not going to be able to help you at some point. And I know it's so hard for me. And I'm like, I know it's hard. And I want you to remember how painful this was 1 month ago when you came in here because you're asking for more pain if you keep doing that. So it's got to be neck.
And the answer has to be awareness of how much time we're actually in putting our body under this type of force. Obviously, we've talked about some of these different positions that you can get by propping your elbow. Even if you're lying down, you can prop your elbows on some pillows, really getting it to eye level. Even putting it out on the table, you can get some propping going on there. It is the cell phone is awkward for that type of usage, and VR, I think, is going to be at least a healthier kind of in a way to interface with the digital that's a bit more conducive to full body movement. But we're not quite there yet.
I love all the stuff you're talking about. I talk about your head's got to be here and you're bringing the phone right up to your face, right in front of you. It's much easier to fix a wrist, elbow, shoulder problem than it is to fix a neck problem. So put the load on your arms instead of your neck. And I have a 6-year-old and a 3-year-old son, and we used to have iPads. And I remember before we had a television, they would sit there looking down. And I told my partner, Katie, we need a TV because they need to be looking out in front of the wall. If they're going to watch something, we got to get rid of the iPads. The awareness part, like you said, is people have to want to be more aware and to prevent that. And unfortunately, sometimes they need to be scared into developing that awareness, but it's the only way to really not put ourselves in compromised positions is to cultivate awareness.
And yeah, that is the way out of these compromises that happen. So walk us through, like, how where's the, how does it how does the adhesion begin?
Yeah. So adhesion forms from overuse or trauma. You can have a lot of stress in a 1 second window where they're in a car accident and they go whiplash, and then they'll get an adhesion and other bone damage, cartilage damage, whatever. Or you could have a little bit of overuse over a very long period of time, like looking down at your cell phone. So what the overuse does is it ultimately causes a contraction, either a lengthening in the tissue, which ultimately becomes a contraction in the tissue because tissue, muscles, maybe even ligaments and tendons, but definitely nerves, muscles and nerves don't like being lengthened or shortened for long periods of time, because if you take the fibers and you start compressing down over the blood vessels, then there's a restricted blood flow going through your tissue, your fascia, your spaces, your muscles are red, they're perfused with blood flow. So when there's restricted blood flow, you get free radicals coming in, damage is caused, then these tissues cells called fibroblasts come, and I imagine that the fibroblasts are like little spacklers, and they come and they spackle the damage in your body with this little glue that is known as adhesion. So that's what causes the adhesion to form. And so anything that is not getting regular blood flow through our body, but also is keeping our muscles at either a very long position or a very short position, is going to ultimately restrict that blood flow. But we need to be moving our bodies to getting that blood flow through, and then also just get working on our muscle dynamics. I think you talked about this with your first step of how you help people restore their posture. But if people are doing foam rolling or lacrosse balling or some type of pressure work, they're working with the fluid dynamics of the tissue. And when you're moving fluids around tissue, you are helping your body recover and just keeping your body healthy, let's say in a 2 to 3 day window of how you would form adhesion. So it's not a long term investment. This is more of a short term investment. But ultimately, the posture really is what is the long term investment in res- minimizing and preventing adhesion buildup, which ultimately is preventing all chronic musculoskeletal pain.
With a very severe curve, I've got a lot of different compensations that can have formed throughout the years. And my approach is an all terrain agility. That's truly what I want to build. And so I'll go for a hike and look for those climbs where I've got to really put my leg over here, my hip over there, and crawl down and really start to identify positions that I may have never been to before in my life, because when I'm in that position, I identify a weakness, a restriction. And for me, that's gold, because my idea is to go there to find out, why is there restriction there? Does there need to be restriction there? Is that just, am I just going to live with that? Am I going to allow potentially a part of my body to remain stagnant, primarily from a lack of motion? And that seems to be what you're referring to, that this at least being able to use and activate, and whether it's contraction and expansion, that use is going to be your guide towards health. Is that accurate?
Yeah, I mean, yes, I think the value in what you're talking about doing is, and honestly, you're inspiring me because I'm realizing I'm 39 years old right now, and I played college football and rugby, and I did CrossFit for 5 years. I shouldn't have been doing that, and I beat my body up in some of my joints. And over the years, I've developed a lot of fear around putting my body in different positions, and so I'm currently in the practice of starting to first work with my mindset around fear and what my body can and can't do, and making sure my subconscious mind knows it's okay. Working with some qigong motions where I'm being a little bit ballistic with how I swivel my hips or move my body, and put my body in those positions like you are, that you're able to develop tension and force production in a certain area of your body. Let's say that you fall in this weird way and you can catch yourself. I think the value of what you're talking about, especially, is that ability to be bulletproof, which a lot of people talk about, and protect yourself. But yeah, as you're doing that and you're activating that musculature, you will be making sure that blood is diffusing throughout the tissue and preventing adhesion buildup. So I like the idea of using the body in various ways, because you will develop the strength that will allow you to feel better in your body, and then you'll also just be preventing risk of adhesion buildup and chronic pain in the future. So I love that approach that you're doing.
And when it's combined with the awareness that what you're thinking as you're going into that place is important. And I think one of the easiest ways to understand, I think, where we're going is like the horse stance, right? You're in that horse stance and you get lower and then you start feeling tightness, maybe feel weakness, but it's really like the thing to include in your awareness in this practice is, where's your mind at? Is it like, is it panicking because you're deep? Is it protecting? Are you like, oh, I don't want to go there because I'm going to break something? Like, just observing the mind, and then noticing how, with your breath, you can retrain calm. You can get the assistance you need to create that feeling, that stability, that safety that you might need. And then you can, with your breath, start overriding those reactions that you might be facing as you're going into a restriction or a tightness or protection. And it's a really kind of powerful thing to see, because that can be applied to all different parts of the body and all different types of movements.
Yeah, I mean, I love what you're speaking to, mindfulness. You're speaking to using movement as a form of mindfulness. So not only are we training the body, but we're also teaching our mind how to be healthier, mentally healthier, emotionally healthier, and how to optimize the subconscious mind so that we are fit, not only from the physical perspective, but we can handle different types of stresses that may come our way. And I think it's ultimately that type of training that also, should injury come upon us or pain that's acute and maybe becomes chronic, the best way for it to, or the best way to have the highest odds of healing it ultimately come from a mind that is conditioned in the way that you're talking about, Sam, where somebody has practiced putting their body in these stressful situations. They calm the nervous system down and they let the body know this is going to be okay because my mind is in charge. And I mean, I'm a quite spiritual person, but I believe that my mind is God's mind, and therefore, if God's mind says that I'm going to be okay, then it's going to be okay. So I love that, using the breath and working with the stress of the movement and the posture in the way that you're speaking about.
Hmm. Yeah, I mean, when you look at the etymology of the word spirit, is in spiritual, it's in inspire. It's you're breathing in this in the spirit. So which where do you take that in your body, and how do you process that and embrace that is something to consider. The so I see that you've honed in on nerves. You're doing a lot of work with nerves, and so with a muscle where we can contract it and we can expand it or release it, we contract and release. What is that like for a nerve? And just because I really want to help people who may have no idea of these anatomical words, and that 16-year-old who's faced with posture a lot of the time, a compromised posture. There's so much to learn. That intimidation of the amount of knowledge can really hold a lot of people back from understanding that they can actually do so much about it, because there's so many different systems in the body. So I try to keep it as simple as possible. And as soon as we get to that layer of the nervous system, we have the potential of losing people. We have our brain and which extends through a spinal cord, a noodle that goes down through our spinal column, and then it branches out into our body. And then, from my understanding, plugs into this web, this connective, communicative web of fascia that is throughout the scaffolding throughout the entire body, holding our structure, our muscle and skeleton structure. I mean, now we have the nervous system, and we're honing in on this, and we have these kind of branches that come from our spinal cord, and we have things like nerve flossing. And so that can you speak on what is the equivalent, understanding that we can contract and release a muscle? What can we do with the nerves in our body?
Yeah, how to conceptualize this. I like to think of muscles as bags of meat on our body. More than anything, it just helps people when they're eating meat. They can have a little bit more respect for the animal they're consuming and where it came from. Then we have these sturdy structures that are bones that are hard and that our bags of meat can hang on. And then we have our fascia, which is basically these envelopes of spider webbing that kind of pulls everything together and keeps it together. And then the idea is that if you're creating a robot with bones and muscles and fascia, how do we get that robot to have AI that it can start doing stuff? So you can put a computer inside of its skull that can think and do things, but now you have to connect the computer inside the skull to all the bags of meat all around the body that need to do stuff. And so you can send these little strings from the computer through to all the different muscles in the body, and then the computer through those strings, which are the nerves, will be able to tell the muscles contract. We'll also be able to feel, and say, how is the body doing through those nerves, and bring it back to the computer. So it's like a communication highway that kind of looks like a tree, where the spinal cord's going up and it's into the brain. And you got this big puffy thing up here, but you got the spinal cord going down, and then all the roots are going throughout the entire body. And it's just a beautiful thing that it can communicate so fast and so quickly.
Now, are
But I
these,
think
is
that's
it strings or is it like fiber optic cables?
I like that better.
Is
Fiber
it
optic
like those
cables.
coated cables, right?
Coated? Yeah, sure.
Like a wire
I mean,
coated, or is it fiber optic?
oh man, I want to say fiber optic. That's what my intuition's saying. But I mean, and the cool part about it too, that I'm not super knowledgeable about, is there is also a quantum aspect to our body and our cells. The quantum physics aspect is that there's no time that needs to pass between a message going from one cell to another. And so I'm not super adept at the knowledge that's required there. Go ahead.
Well, yeah, I've heard that the fascia is that quantum level,
Yeah.
that where every state it's acting in instantaneously together. It's acting as one from your toes to your tongue on the fascial network, whereas
Yeah.
the nervous system is more of that electrical network where you're actually talking in a world of physics. So it's actually
Yeah.
electrical impulses that is being sent, which does tie into that fiber optic analogy.
Yeah. Yeah. There's a lot of stuff with the fascia. I mean, how the heck does it store emotions and trauma? I don't completely understand this, but sometimes a couple weeks ago, I was treating a woman's on her belly, and she started crying. I don't understand it. I understand that they say that the fascia holds trauma. It's just interesting to me. How the heck does this happen? I don't
Mm,
know, but it's very miraculous to me, all of it.
yeah. Well, there's looking at it as an extension of those roots of the nervous system. To me, it's well, if our brain is perceiving a traumatic event, whether that's an abusive situation, emotion, it could be emotional, whether it's a predator jumping out of the bushes, whether it's that whiplash, like we've got a severe shock to the system. So what's happening during that shock? It's the system is redlining, and sometimes it gets stuck in that redlining state, and sometimes it can imprint so ferociously that message into that system that it can get stored in there. That's the extent of my understanding of it. I'm sure there's some better ones out there, or more detailed ones out there, but ultimately, and the reason why I do want to talk about these things is that we all need to have our own understanding of it, and it doesn't all we can't all expect that everyone with a compromised posture is going to understand the technical aspects of what's actually happening in this, because that is a massive barrier for people to understand that they do have the ability and the responsibility to really guide this, like to take themselves on this journey. Because if we make this too intimidating for people, I've just seen it. Well, I need someone to help me. I need this doctor to do this. I need this specialist to do this. When ultimately, if there is energy in your body, there are ways under the guidance with professionals, with people who have guided you into that area of the body before. There's I'd like to invite people to attempt to imagine what's happening, and they can imagine it in their own way. And it doesn't, I believe, it doesn't need to be 100% technically accurate in order for their imagination, their recalling of the memory, their processing of the memory to provide some benefit on their healing journey. That makes sense.
I love what you're talking about. I think that we're doing, let's just say, culture is doing a massive disservice to our people, humans, when we don't have a basic operating manual of how muscles work, how fascia works, why posture is important, and we're just causing massive harm. We should not be allowing children to be texting the way they are with their head down like that. They don't know any better, and then the cost is just way too high. So to be thinking about teaching people to have a basic understanding of these structures and these tissues, so that they're going to just feel better when they have better posture, and they're going to have less pain, and they're going to be fitter, and their life is going to be better. I love that you talked about just wanting people to understand. I don't know if I've heard that recently from an individual who coaches people like you do on their posture.
Yeah, and I'm even looking into. I'm currently scripting my first couple. By the time this is out, they'll probably be out. But I'm scripting some stories because I think stories is how we've always learned. And even these cartoons where, like the Avatar, I've seen clips of these kind of children's stories. I think we can all we would all benefit if we're able to get some of these ideas that we're talking about into that level of illustration, because ultimately I believe that, as we were saying, that mental state that you're in, whether you're saying, okay, this particular muscle, the piriform must release and allow this mobility through my psoas, and do, like, you don't need to have that imagination. It can be in, okay, how you perceive tightness and restriction, and you could imagine fluffy cow, a fluffy cloud, and a cable being released, or a different gliding motion, or whatever. However you vividly imagine what's happening is can be very useful, and it doesn't need to have that technicality in it.
1,000%. The
But
story will help people learn and digest it a lot easier.
and with the assistance of someone like you who can go in and look at it technically and tell them where what they can do, it does open up that imagination as well. So I see that you've done a lot with the feet as well. I'd like to, as well as if there's parts we missed on the nerves, because we get a little about the analogy, understanding what is the nerves and their function there. But how how do you go about releasing, and if that's in the feet, then let's go there.
Okay, cool. I mean, my practice in New Jersey is named Barefoot Rehab. I read the book Born to Run in 2009. I was really into barefoot running, and the whole idea of getting back to nature and as close to natural as possible really spoke to me. So that's what Barefoot Rehab meant. But yeah, when people have chronic foot pain, depending on where it is, first plantar fascia is usually the first thing. Plantar fasciitis is what they have, but there are so many tissues in the bottom of the feet. And then also, when people do have chronic issues in the bottom of the feet, it usually starts as nerve entrapments. We know that muscles are pieces of meat. We know that the fascia is spider webbing. We know that nerves are like strings or little pieces of noodles going throughout the body. So let's say today I was treating, there's a patient, I've been treating her hip pain. Her hip pain's 40% better. Her next layer of pain was her medial knee, the inside of her knee, and her second toe when she's walking. And so she feels the toe first, then the knee, then she feels the glute pain again. And so we did a straight leg raise. Her leg should be able to come 90 degrees with her hamstring flexibility. And it was restricted. I think it was like 65, 70 degrees. We dorsiflexed at the top, pulling the nerve going between the calf and the foot, and it increased her symptoms behind her knee and her calf, which is a good sign that there's some type of tibial nerve entrapment in the calf or going into the foot, where it becomes the medial and lateral plantar nerves or the digital nerves at the bottom of the foot. So I started right around her second toe because she's having just one toe symptom. And I'm looking for that noodle, and I feel the noodle between the first and the second toe. And then I start, if the noodle's like this, and it's thick, it's like a angel hair pasta, and I'm pushing it and I'm moving it and I'm seeing if it moves, because all nerves should move inside our body. And right below the joint, it's called the MTP joint of the toe, it's stuck. I go to push it and it's not moving. So this spot is glued down by adhesion and is likely causing her second toe symptoms. So what do? I get my assistant who grabs the first and second toe. I take my thumb and I wedge it between the nerve and the muscle. And then my assistant starts bringing the toes backwards. And then I am separating the nerve from the muscle tissue as my assistant is stretching the toes. And that's how we free up a nerve entrapment. And it's very mechanical. There's meat, there are noodles, there are bones, and this stuff shouldn't really be glued to each other. And if it is glued to if the nerves are glued down, what ultimately happens is that you start getting contracted muscles or knots all over the body. And then people try to stretch those things and foam roll those things, and you lose a cross balls, and they get really frustrated when it doesn't get better because the nerve's actually stuck. But when you can free up a nerve entrapment, those contracted, hypertonic, knotty muscles go away. So that's what I do in the feet and everywhere else on the body, it's the same principles. Where's the nerve not moving? And then how can I strip out the adhesion or the glue between the nerve and that muscle?
Amazing. Hyper targeted, I guess, and much more efficient than just intuition. Because I think with my knowledge of the nervous system, it's really just been intuition. That's when I get things happening, maybe on the upper part of the trap there. I can tell that, okay, it is a nerve issue. I've got some tightness there. But really, yeah, I guess I try to go with intuition, and it probably just takes a longer time to get it out, I think.
Whatever works. I mean, if
Yeah.
intuition is getting relief and releases, then I love it and you should keep using it, Sam.
Yeah.
But yeah, for me, it's been a lot of training and learning. And my mentor retired in 2020. And then I spent 2 or 3 years trying to see or who around me was going to start teaching. And so in January 2023, I started teaching other chiropractors, massage therapists, physical therapists with adhesion release methods. And we're the only diagnostic and treatment system helping people become world class at fixing adhesion. And it's just a lot of hands on instruction. That's how I got good at
Yeah.
this. And so that's what I suggest that our doctors and therapists start doing in order to be able to feel this stuff and fix it.
When I started realizing how important the feet were, well, one, I went for the minimalist barefoot shoes, which I still carry on today. I feel like I'm not, if I'm in shoes that I can't really activate my big toe, I know I'm not where I want to be. So I always look for the minimal soles. The Nabosu ball, I've got this ball and that splits in two, so you can have that. I have that by my work desk. And then the toe spacers. I thought they were a little, yeah, I don't know. And then I put them on and realized, okay, oh, that's activating some good movements there. Any tools that you like on your rehab journey, starting from the feet up?
Oh boy. I mean, this is self-grandizing or whatever, but we produce a product called the Grip Bar. And the Grip Bar is so my mentor he had all the Graston tools, all the sound assisted treatment tools, spent probably tens of thousands of dollars on instruments. And he used to have us use this little $5 gua sha tool until he decided to produce his own tool, which was 100% stainless steel and a specific bevel and metal and curve. And that was previously only available to adhesion specializing doctors and therapists. And then I took it and rebranded it as the Grit Bar and started selling to consumers. And it does not work. Sometimes people buy it for everything in the entire body. I'm like, no, wait a second. Did you read the description? Because I didn't say you can use it on the entire body. And I also didn't say you can use it on severe pain. However, if you have tight tissues or mild to moderate pain in the plantar fascia or the dorsal foot, or the front of the shin or ankle, that is one spot that the grip bar or an instrument will work very well based on the principles that instruments work. So that's probably the biggest thing that I've used to maintain the quality of my feet over the years is I will treat my plantar fascia with the grit bar every 2 to 3 days, and then the tissues around my toes and the cartilage and the bones in order to keep it well. But besides that, I mean, the strengthening has been important for me. I can't think of any other thing that I've used to keep my feet healthy and well besides that.
Well, I mean, yeah, the even
I hope
just
it's okay I
the
shared that, by the way.
of course, no, yeah, of course. The grip, I just checked it out now. It looks like you've got a particular way to use that. It comes with instructions.
I created a course because there are ways to use it well and not well. So I created a free course that people get when they purchase it so that they know how to use it and they get value from it.
Nice. And then what are you currently offering in terms of assisting people? Is it in person? Do you have online offerings? And where can they find you?
Yeah, I primarily see people in person. So people generally will fly in if they're not in New Jersey to see me. But what I did last summer, like I said, I'm now teaching other doctors and therapists. We have a website. It's called www.findanadhesionprovider.com. And I think we have maybe 30 providers right now across the world who I am training and 3 of my colleagues are helping to train, so that people who have chronic pain, maybe with postural issues, can find somebody who specializes in non-surgical relief for them. So the best place that someone who has chronic pain and issues after doing postural work with you is to go to that website, findinadhesionprovider.com. And my goal is, it's very sad for me to have people, we just passed 500,000 subscribers on YouTube yesterday, and it's very
Awesome.
sad for me and our thank you and our VAs to get all of these messages from people across the world and say, I don't have the resources to come to New Jersey. What do I do? So I'm working hard to get more providers. We just had our first provider in India sign up. We have our first provider in the UK who's coming to train with me in 2 weeks. And so I'm really trying to get people throughout the world doing this so that more people in chronic pain can get out of it. Because with your kyphosis, and I know when I had my chronic low back, hip, shoulder, foot, whatever pain, it sucks the life out of you. And I really want to
Oh, yeah.
do whatever I can to help people get their quality of life back.
Interesting. Yeah, because that's it's the biggest driver for people to start going into action, and it's usually the number one priority. The pain is like, hey, your body needs the attention right now. What can we do? And so I think part of it's sifting through people's real motivations, because I know my motivation when I was in pain, I just want to get out of the pain. But did I want to do the work that would put my body free from pain for the rest of my life? I don't know if I was there yet. It's a different level of motivation that's
Yeah.
required there. So, which type of therapists and people and practitioners would stand to benefit from this type of training?
Legally, it's anybody who can put their hands on people: chiropractors, physical therapists, massage therapists, naturopaths, osteopaths, acupuncturists, maybe even medical doctors. So far in the last 18 months, it's primarily been chiropractors, massage therapists, a little bit of osteopaths and PTs, but maybe because I'm a chiropractor and some of my friends started training this when I started it. And with massage therapists, I have 2 apprentices right now. They're my first 2 apprentices who are paying me to train them every single week. And they're both massage therapists. And I think there's massive opportunity for massage therapists who want to get better treatment outcomes, charge higher rates, and be treated with greater reputation than other providers. Because once you learn this skill set, you can fix people in pain better than surgeons who are cutting people open are, as a generalization goes. So I'm really focusing a lot of my time going forward on how to speak to massage therapists to let them know 90% of massage therapists burn out after 5 years. That's absurd to me. They make $40 an hour according to Indeed. That's absurd to me. So our best massage therapist right now is in North Carolina, and he makes $110 per 20-minute visit. So that's $330 an hour because he gets great treatment outcomes. And people from all around North Carolina, Carolina go to see him. And I'm really proud of that. And he's helping people suffer less. So I'm really focusing on the massage therapist path when people, because they just have a lot of opportunity.
Sure. Yeah. I mean, massage is, you're already working with the body, the muscles, the fascia. And yeah, you add in a few extra tools in your toolbox, and you've got a real way to help people. That's having hands on people is that challenge when it comes to creating a protocol for someone to go through to truly transform their posture. There is a big benefit to it, and I know at one end of the spectrum that's really important. And then I just try to build the protocol to make sure they know what they're doing every other time. It's only when
Mhm.
people have, oh, well, I was with a, a Schroth scoliosis specialized Pilates or yoga or physio, and then I moved and then I didn't do anything because they needed that person to do something. And you can have profound benefit from doing stuff with people, but you also have to find that responsibility in yourself to be like, okay, every day I'm breathing, every day I'm holding myself, every day I do have awareness that I can place where it's important. but we wake up and we open our phone and we get intended upon. Everyone's intentions are trying to pull us in 1,000 different directions. All I can do is invite them to say, hey, your wellness, you're making yourself the intention first thing, making sure you're well, making sure you're out of pain. My experience of you in this world is going to be better. So that's the best thing that you can do for me is prioritize your wellness. Bring some awareness towards that pain. PAIN, right? Pay attention, integrate now. What needs to be integrated? What restriction is getting in the way?
I love that because I really love the quote, choose your hard. And what you're saying is it's hard for people to prioritize and do the stuff that you're doing. And I think I saw an obese person yesterday eating some crappy food from some fast food restaurant. And I remember thinking, like, you chose the wrong hard. You chose the wrong hard. I get that you don't want to do exercise and eat well and do that stuff, but it's going to get much harder for you, my friend, by being that way with your body and by making those choices. So it sounds like you're helping people choose the hard that's actually going to make their life better and easier.
And that they actually have a choice. Because many people
Yes.
walking out of the orthopedic surgeon's office is, well, I didn't get, I'm too old for a brace and I didn't get surgery. I have scoliosis and
Right.
well, I don't know anything that I can do about it. So part of that piece is, yes, knowing that you can do something about it. And then the next piece is actually doing it, actually doing that hard work. And when I think about those teenage years when I was on the computer, ignoring it, just paying attention to the games and the internet and just getting sucked into the screen, I was just like, I at the back of my head, I'm like, I'm taking a shortcut. I'm feeling like something's off, but I'm just ignoring it. And I feel like this is going to cause me things down the road, but that's going to make me different, or that's going to make me, I'll figure that when I cross it or whatever.
Right.
And what a path that's taken me down. So you got to listen to what your body's saying. It'll have a lot of good stuff for it. And the journey of getting to know yourself and your body is one of the most rewarding journeys that each person can take, I think.
I don't know of any other more rewarding thing. I think that's why we're here, why we chose to be born on this, in this consciousness, on this plane, on this soil. So I love that you're helping people become more grounded in their body and helping people choose the right path and to take care of themselves. And you're right. I was just talking about choose your heart, but you said the fact that there is a choice. There's always a choice. And I think that's a beautiful thing to help people see.
So let's wrap up with something practical. Maybe if someone has been watching this podcast with their head down for a while, longer than they expected, what do we have anything to open up to? Maybe I know these type of nerve flossings are interesting for some of that, but when we have that tight forward neck posture, what's some simple things that we could be doing to get out of that?
I will maybe I'm going to answer your question, maybe not the way that you want me to answer it, but I
Sure.
think that maybe is a little bit more practical. But going along with your posture message and preventing chronic pain, and still a lot of people love stretching these days. Patients always ask me what they can do to minimize adhesion buildup, prevent chronic pain, so on and so forth. And I usually tell them I really don't care about strengthening. What I care about is them bringing tension to the appropriate musculature. So if and usually bringing tension to the appropriate musculature means strengthening something. So I got a little bit away from working out 4 or 5 years ago, and I noticed that I was having a hard time standing and sitting with my chest out. And so I was more slouched forward and my scapula were more moved away. And I remember thinking to myself, I just need to bring more tension, resting tension to my rhomboids, to my external rotators in my shoulder, to all the tissue back there. So my scapula just sit back here and I don't really have to work or do anything to make it better. So I'm a really big proponent of bringing appropriate analogous tension forces, doing pushing exercises horizontally and doing pulling exercises horizontally, doing exercises for your quads, exercise for your hamstrings, or you can do core exercises that work both. But with the idea of saying, how is my resting tension between these opposite musculature? Because if you can do that, and then you consciously make the choice to maintain your posture, we are setting ourselves up for minimal joint degeneration. And when you minimize joint degeneration, you have true longevity when it comes to fitness, minimizing pain, and having a really amazing life. Everything I'm doing is for the purpose of minimizing joint degeneration, minimizing pain, so that when I'm 80 years old, I can still walk a mile in less than 15 minutes. Because the research says that when you can do that, you have a 95% chance of making it to 90 years old with a good quality of life. So bring the resting tension of your musculature to where it needs to be through the proper strengthening exercises with Sam's help.
There you go. That's a much more sensible long term option. Instead of trying to treat the symptoms of a poor habit, strengthen the strength. It wasn't quite strength. It was more of an activation of a more healthier, a more efficient postural, myofascial structure. I guess that's your goal there. And a couple of ways that I've found recently to do that is if I'm hanging, going from a flexion to the extension in the hang requires my full muscular and myofascial chain, muscular and fascial chains to activate on the front and on the back. Front,
Mhm.
back, that's great. Because, and if I have a tight, sore neck, I'm realizing I'm not activating as well as I need to in that part of my entire chain. And I get awareness in that and I can get alignment in that, because then as soon as I become aware of that tension getting in the way, I can let go of that tension. Same effect if we're just standing and we kind of rock back and forwards onto our toes and onto our heels, right? Our entire kind of posterior and anterior chains have to synchronize, have to activate at the same time. And if we've got interruptions or restrictions in that chain, again, it comes into the awareness, and that awareness allows us to let go of that.
Mhm. I love it. Your clients are lucky to have you, man.
Yeah, but I want to honor the work that you're doing to deliver a really valuable skill set to a lot of people who can put their hands on people and help us get a bit more flow in the body.
It's I thank you. It's very rewarding. It's challenging. It's very rewarding. And my goal is by the time I'm 69 years old, that's 30 years from now, to have 5,000 providers across the world. So I'm taking that goal seriously. And I want to, yeah, between you and I, you got the posture, I'll get the adhesions out, and then we could help people have a better quality of life.
There we go. Nicely done. And so I'll include some links in the description to help you on that journey. And I want to thank you for coming on.
Thanks for having me, Sam. It was a pleasure.
Cheers, Chris.